All right, let's go to chapter 16. This is module 11. You're going to have chapter 16 and 28. 28's content you're going to find back in module 1. Remember, I kind of messed that one up. So check module 1 PowerPoint out again and just see if there's anything there that you can use. All right, so chapter 16, we're going to talk about thyroiditis, Hashimoto's thyroiditis. The T3 is abnormally low. You can see that on table 16.5 on page 420. Um, Again, I don't really go page by page. I just kind of get in here and start talking about some stuff. So if you'll see that table, it kind of tells you a general comparison, hypo versus hyperthyroidism. The serum levels of T3 and T4 are low in hypothyroidism. It gets complicated. Your textbook doesn't say a whole lot about it, but I just need you to kind of know that. All right, also hypothyroidism, in that the basal metabolic rate is low as well. That's also on your table on 16.5. Now let's look at page 425. Serum calcium levels. What happens if someone has surgical removal of the thyroid gland? A lot of times it'll cause hypoparathyroidism, which can lead to hypocalcemia, which the symptoms for that are tetany and possible cardiac arrhythmias. And you need to remember that as well. Now let's talk about diabetes, the different types. Type 1, some of you may know it as insulin-dependent diabetes. There is an absolute insulin deficiency in the body. What are the symptoms that you're going to see? Just remember the 3 P's. They're hungry, they're thirsty, and they pee a lot. So what causes that polyuria? Well, there's not enough insulin in the cells, so there is a decrease in transport and use of glucose in the body. Because of this, they have hyperglycemia. This excess glucose then spills into the urine, causing glucosuria. This causes the pressure in the kidneys to produce large amounts of urine. With this excretion of large amounts of urine, we also lose electrolytes, sodium and potassium. This leads to dehydration, thus the increase in thirst. Now, the polyphagia comes into play because the cells are not getting the glucose. Remember, they can't use it, so they're starving, they're hungry. And the body is telling them, you know what, I don't have enough glucose, I'm hungry, and they want to eat. All right, so type 2 diabetes, non-insulin dependent. There's decreased insulin production or an insulin resistance. With obesity being the big factor here, and the patho behind that is that the greater amount of adipose tissue someone has, the greater their insulin resistance is going to be. So they just don't produce enough. They produce some, but just not enough to take care of the metabolic needs. Okay, so let's go to the next. All right, so what is diabetic ketoacidosis and what causes it? It happens when there's increased catabolism of fats and proteins because a diabetic can't use that glucose. Their body has to have something, so we start using fat and protein and we break that down to use as fuel. And those fatty acids then that we know are ketones that end up in our blood. This usually occurs in type 1 patients. What can precipitate it? Ketoacidosis, we call it DKA. Infection. Infection in the body produces hormones like adrenaline and cortisol, and that further counters the effects of the insulin that we're giving them. They just cannot maintain a normal blood glucose level when there's an infection. How do we identify somebody with hypoglycemia? Let's look at page 407. You have your signs and symptoms. Initially, you may see some slurred speech, poor concentration, lack of coordination. A lot of times people will think someone is intoxicated because of the way they're acting. But then the sympathetic nervous system will kick in and you're going to see increased pulse, pale, moist skin, anxiety, and tremors. If this goes untreated, we can have loss of consciousness, seizures, and death. Just remember as far as what some of the symptoms are. Remember which nervous system kicks in, but you can also kind of remember the little mnemonic. Hyperglycemia is high and dry, and hypoglycemia is low and wet. All right, get your activities done and take your quiz.